I'd like to call the special joint meeting between the City of Apache Junction, City Council, and Health and Human Services Commission to order. The pledge will be led by Mr. Braden. Whoops.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Councilmember Schroeder,
Here.
Councilmember Nessler,
Present.
Vice Mayor Rizzi, Mayor Wilson,
Here.
Councilmember Biggs.
Here.
Councilmember Evans,
Here.
Councilmember Gremmel,
Here.
Commissioner Bory, Commissioner Kinner, here. Chair Mitchell,
Present.
Vice Chair Erickson, here. Commissioner Brennan.
Here.
You have a quorum, Your Honor.
Thank you. Welcome, everyone. Okay, discussion on fiscal year 2021 contact expenditures from the local nonprofits in the City of Apache Junction. Anna, do you want to start this out?
Good evening, Mayor and Council and members of the Health and Human Services Commission. My name is Anna McCrae, Assistant to the City Manager. Thank you for being here this evening. This was a result as a direction to staff from the council meeting on Tuesday, February 15th to hold a joint meeting between these two public bodies to discuss the fiscal year 21 contract expenditures that's allocated through the fiscal process of adoption of the city budget. And it's really your policy discussion to have and an interactive meeting between the two of you.
Okay. Does anyone from the commission have a comment they want to make before we start? Don't see anyone moving, jumping up and down and trying to express themselves. Okay. How about from the council?
Oh, you're on.
Tess?
I do, but prior to that, Vice Mayor Rizzi was just texting me. She said we can call her if we need to before we get too far going.
Time out.
Just give me one moment. Sometimes it's hard to hear people on the phone, so we just have to listen closely when she can hear us.
Hi, this is Krista. Leave a message and I'll get back with you as soon as possible. Thanks and have a great day.
Braden, tell her. and answer the phone.
I did, yeah.
She's probably used to the
She
other.
just texted me and said, I'll listen for the call. I said, no, I'm calling right now.
I like the strobe light in the back. Me too. That's pretty bad.
Hey,
Text people and tell them
Anna.
to answer your phone.
Can we fix the flicker lights? Isn't it one of the switches that?
We'll just have to turn them off. The ones to the very right, right? No.
I was enjoying that.
Hi, this is Krista. Leave a message and I'll get back with you as soon as possible. Thanks and have a great day.
I'm calling her
She's not at
cell
that
number that I have that we usually communicate on, so.
Okay. All right, well, Braden?
Yeah. So I think we, over the years, have had a lot of conversation around health and human services and the funding that's given out to the various organizations. And I think that there's definitely no question that our organizations do great work in the community, but I think some of the things that I've heard from constituents and even from some of our nonprofits who receive funding is that there's certainly a better opportunity to get the best bang for our buck. So right now, I think we give about $80,000 out to different agencies, and there's some duplication in those services as well, because we might give funding to, let's say, the Salvation Army, and then also the food bank, who are both giving out food boxes and different things. And with that, are we serving more people? Are we serving the same people? So that's something that I think, having that kind of conversation and figuring out if there's an opportunity for those organizations to work more collaboratively together, so that we might be able to give them larger funding if they're working together. One of the other things I've heard from some agencies as well is if there was an opportunity for multi-year funding. They all know we have limited funds, so they try to reduce the amounts of money that they actually look for. But there might be an organization that maybe wants to go after like a $50,000 amount of funding, but over 2 years or 3 years. So that's an opportunity there that provides them some longstanding funding. And then one of the other things I've heard as well is we do have agencies that have received funding year over year for quite some time. And as the stewards of that money, we need to make sure that the programs are viable programs, but also that we're not just giving the same funding to the same agency because we've always done it that way. There might be some opportunity to say, hey, we'll give you funding for 3 years, and after 3 years, you have to be off of it for 3 years before you can reapply. Is that funding used to sustain a program year over year, or is it used to start a program and get it up and running and then go from there? So that's a part of the conversation. And then in my talks with some of the agencies as well, and then just in general in the community, one of the things that I would really like to see is an opportunity to work directly with you guys on the Health and Human Services Commission, as well as our agencies, on doing a community needs assessment and setting aside some funding through the Health and Human Services funding for 1 year to give back to you guys on the commission to say, hey, work with staff however we want to do this. If we want to hire a consultant, if we want to work through that process to actually go out and figure out what it is that the community needs, what it is that our agencies need, and how we can best utilize that funding. So that's one of the proposals that I definitely really like to discuss and get your guys' feedback on as well, and what we might be able to do there as an opportunity as council moves forward here in the next few months, reviewing your guys' suggestions for funding for this next fiscal year. So I'll kind of leave it there for right now.
Go ahead.
If I might speak to that a little bit, Braden, the Health and Human Services Commission, in the years that I've been on, one of the questions I've always asked the agencies applying is, this funding may not be available. What is your contingency plan? What are your plans to become more self-sufficient? We really see this funding, predominantly to help institute programs that would benefit the community, maybe new programs that are essential to our community. And I think in trying to identify, what are the needs of the community, that is something that I think we need the entire community's input for. Other communities have put together a priority. Their city council would say, for instance, one of the communities in the valley has top areas of need ranked, and so then their Health and Human Services Commission can really identify which applicants are able to provide for the needs of that particular population. In this other community that I'm looking at, housing was number 1 for all incomes. Behavioral health was number 2. Interestingly enough, food insecurity was number 7. So we can't go by another community's needs assessment. And I think everybody has our own individual idea as far as what is the largest need within our community. But I think, a systematic way of identifying that would really help us, as would consistent meetings with the different agencies, helping them to identify ways to partner with one another. Being able to partner with one another strengthens the agencies and strengthens the community, and really should be given priority for funding.
Absolutely. Any? And Mary, I would agree with that. I think, something, I know each agency has rules and procedures that they have to follow in terms of getting the grants. And I think I know one of those is turning in the reports to the city clerk, which is then reviewed by you all, I believe. And then, but I don't know if there's necessarily a requirement to come and give a report, on a quarterly basis or even a semi-annual basis to the commission, to council, to the general public to really know what's going on with that funding. It really kind of seems that we, as both the commission and council, we give out the funding and then we don't hear back until the following year when it's time to reapply for funding, and then we're told the numbers. We don't hear any of the successes in between. We don't hear the challenges. So I think having that opportunity to, maybe even have that as a stipulation that if you were a funder, or if you are an agency that receives funding, you have to meet, quarterly with the other agencies and the Health and Human Services Commission to make sure everything's working together. There's definitely a lot of opportunity for collaboration there.
On the surface, it seems that part of the evaluation is predicated on the subjective assessment by the organizations. Is there any effort to get a understanding of whether or not if you will, a satisfaction sort of review to see if those services are being realized by the recipients, so that you can better gauge whether or not that's being done, or if somehow there's an idea to do such things, but it really isn't being broadly manifest.
Mm-hmm. And I think that would really depend on the agency. I know in just from my experience in working in the nonprofit field, I mean, we did, surveys and stuff with our own with our own clients and everything to try to figure out if we were addressing their needs, but I don't know if every agency is, and every agency is going to look a little bit differently in terms of how they do that. So I think that's a great thing, an evaluation tool to know, that one, the agency is meeting their own goals, but then we know that funding is meeting the end goal as well. Because I think, we can give out money for food, but if we don't know that it's actually addressing food insecurity, are we really doing the best that we could be doing?
Best investment.
Right.
Well, I think if you're thinking about food insecurity in particular, the best place to get it is the food bank. They're doing a tremendous job. And looking at the data since 2011, that's what I have in front of me, they've received funding in this particular program every single year.
Mm-hmm.
So it's difficult because I understand your point about multi-year funding and not doing the same thing because we've always done it that way. But because an organization is doing a really good job in a certain area, it'd be hard to ask another organization to fill the needs of the food bank when the food bank's doing it in such a tremendous way.
Absolutely. And not to say that any agency, again, we're not, I want you all to know that none of us are picking on agencies in particular, and that's not the intent by any means, but the way I look at that is, if an agency is getting funding since 2011, that's 10, 11, 12 years at this point, and is the need growing? And if the need's growing, what are we doing to stop that line from getting longer? And I think that is in the hands of each agency to help figure that out. And I think that brings back to Mary's point about collaboration. If we have a growing need where the line isn't getting smaller at the food bank, then what are we doing to reach out to our larger partners in the county through CAG or MAG? What are we doing to reach out to the larger agencies to really figure out how to systematically address the issue? Because at that point, if we're talking food insecurity, the issue isn't putting food on the table, it's what is causing the reason that people are food insecure. And if that's lack of job or, income, whatever that is, we've got to start addressing those needs because we don't have unlimited funding to just say, well, more people need food, so we're going to give more people food by giving out more dollars. So that's the intent, and I think that that's a part of that larger conversation that we all have to continually have as nonprofit agencies, as funders, as partners, and et cetera.
Yeah, I think the best place to get that information might be to have the clients of those organizations surveyed. You know, that would be right at the source. You know exactly what is causing you to have to be here today and why. But I guess in terms of your point about duplication of efforts, I've witnessed a lot of things happening that I think are very encouraging. And I don't think that, like this year for Christmas meals, I know the Salvation Army didn't do it because Genesis was doing that, you know? So it was like they knew that that was happening, that collaboration was there, so that money wasn't put forth to duplicate it like it was the year prior, right?
Absolutely.
So I think that we're getting better in that area.
Oh, 100%. I would agree with that.
Yeah.
I have a question for Mary. For our reporting requirements that we have of each organization, have you found anything lacking or that they haven't fulfilled what was projected, or has there been a problem with this?
One of the difficulties that the Health and Human Service Agency has is that we are not employees, and therefore we do not see the reports. So I cannot answer that. The city would have to.
We've asked Jennifer Pena, and she mentioned that all the organizations did turn in their quarterly reports satisfactorily. Nobody was, you know, not able to meet the goals that the city set.
Well, that's the only way they get the next quarter funding,
Right.
too. They have to turn that in.
Yeah.
Correct.
So then, my question's to Joel. So is there a privacy issue that information is not released to the Health and Human Services? Or we just haven't done it before?
Mr. Mayor, Member City Council, it's weird being up at this dais. I feel like I'm in federal district
It's
court.
weird seeing you there, too.
Yeah.
Okay.
I think it's a staff function to look over the reports. It always has been.
Right.
So if you want to change it, there could be a change, but I don't think it's a privacy issue. And if it is, we could redact information.
Okay.
It would take some staff effort to do that because it might mean all the participants. However, it is a possibility, but it might create, if the commission wants to see it quarterly, then there's going to be redactions that have to be done quarterly by staff.
If it has to be done.
Yes, I'd have to look at the reports. I never see them. I think the city clerk has always seen them and then
She's
signed
the
off
only
on them, and then the check
yeah.
would go out.
So, Mary, do you think that would be something that would help with your decisions from year to year if you saw those?
Actually, what I think would help with our decisions would be having reports directly from the agencies to come in and tell us some of the stories, what really has been working as a result of the funding that we got from the city of Apache Junction. When we hear that, we know that it's been working. We do hear, you know, and the agencies have been good at getting their reports to Jennifer because we haven't heard anything. In past years, we did hear when an agency was not providing their report in a timely manner. And, you know, at one point, I think there was at least one agency that lost their funding because they did not. You know, if they don't do the reports, the funding from then on is null and
cut
void.
off.
It's cut off, which is very, very sad because we have such limited funding in the first place that we are entrusting this funding from our citizens to the agency to be able to help our citizens in need. And it is their responsibility to provide the reports which are required so they can continue with that funding and continue to do the good work that they have agreed to do.
So would you be willing to have or extend invitations, you know, if you wanted to do it all at one meeting, to have them come in once a year, twice a year, and just give you an update?
I think it would be wonderful to hear from them. I think there is a time on our schedule at any given meeting for the public to come in and comment, and we would welcome them to come and just tell us. Maybe something happened, and they just have a good report they want to tell us. That would be great. But I think they could definitely, come and report back to us. We could set it up on a regular basis. It's something I think we need to discuss. What would be equitable for the agencies? Everybody's time is at a premium. But at the same time, for not only us to hear, because this is a public forum, the rest of the community also would be able to hear. And I think that's beneficial to the rest of the community. Perhaps they need more volunteers. They would have a
Right.
public forum. So
Absolutely.
I think there are advantages for them to come and
I have
report.
one more question.
Okay.
So, Joel, in, sorry. In the Health and Human Services Commission, when they have a meeting here, a public meeting, are they like our work sessions or our public meetings? So could one of the organizations show up at any time and just speak? Or, it has to be agendized.
Has to be agendized, and I think they do approve the minutes, so they do vote. They're not all work sessions, but they can be set up so that people could be invited from the different agencies, and we could have separate items or one big item. It could also be a public hearing.
Yeah.
If you want input from the public, you could actually have the people show up who just want to speak on it also.
Yeah, we do have a public hearing part of every meeting, and we just haven't had people taking advantage of that, but we offer it. It's on every
Well,
agenda.
That might be the call to the public you're thinking of
Oh,
at
yeah.
the end.
Is that
But
the same thing, public
No,
hearing
there's a
called?
difference. You could actually have a public hearing process when anybody could speak for 5 minutes on any item regarding the Health and Human Services Commission. If that is agendized for whatever item it is. Call to the public, they can speak about whatever you do for 3 minutes.
And I definitely think that could absolutely be an agenda item to have, because at that opportunity, if you just do the call to the public, they can come and speak for 3 minutes, but you can't interact with them. If
Yeah.
it's on the agenda, then that gives you guys as a commission the opportunity to have that back and forth and find out upcoming events, needs for volunteers, good, the good, the bad, the ugly. So,
Yeah, I always thought that was a public hearing, but we could always add that to the agenda. I think that would be good direction to staff.
Yeah, and then you can also ask questions as well. Yeah. Yes.
So, Brian, don't we really have 100,000 and 20 goes for our senior transportation?
The answer to that, Mayor and Council, Bryant Powell, City Manager, the total number so about 1, 2, 3, 4, 5 fiscal years ago, the East Valley Adult Resources let us know they were not going to be able to provide those services, and so we set aside in the Parks and Recreation budget this year $28,000 to cover those services, and so 28,000, not 20,
Okay,
and then 80,000. So general fund amount towards these services could be viewed, although it's not in the Health and Human Service line item, is 108,000.
okay, thank you for clarifying.
Bryant, before you step down, so I know you and I have had some conversations that as we continue to grow, once we hit that 50,000 population marker, that things change in terms of the funding that we get, because we're going to get some more federal funding and things like that. Can you walk us all through how that works and how that will affect the commission?
So currently, as a community that's under $50,000 or 50,000 in population, we receive funding through the Community Development Block Grant Program, federal dollars through the feds, and then the state, and then CAG, Central Arizona Association of Governments. And the funding allocation for that is right around just under $100,000 a year. When we become a city that is above 50,000, then we become what's called an entitlement city. And any city in the country that's above 50,000 population gets to work directly with the federal government. Currently, right now, that number is about 400,000 a year that comes in, and then the community will be able to have CDBG dollars that are for low to mod income. Occasionally, staff has come to you for what we call state special projects. You may remember Heather Hodgman coming and doing grants that went directly from the city to the state for a one-time $300,000 to help Cedar or different road projects we've done, and we still do those. Those are a little bit different funding source, but those are kind of connected to CDBG. But the answer to your question is yes. Once we become 50,000, Casa Grande just did this. Other communities in Pinal County are going through the entitlement process, and then the city would be able to directly work with the federal government. That's just another funding source, a part of in general services like this that could come into the community.
But that'll, sorry, go ahead.
But it's not a guaranteed number, and actually our competition pile of cities that fit that category grows. So we're in a higher competition sort of market.
Let me clarify, on Mayor and Council, the state special projects money is a competition, and we don't get those every year.
Right.
The 100,000 is what we get every year. But when we turn 50,000, it will be a guarantee. There will be, whatever the federal government's able to do, depending on the different administrations, but that program's been in place almost for 50 years now, since 1972. And it's the Community Development Block Grant.
Brian, so what all does that entail for that $400,000?
So for most communities, they set up what's called a low-to-mod income program. And they have within development services typically that type of a program. Folks who can do housing rehab, or we can set up programs that could reinvest in. It could be, you could have a system like we have here through the Health and Human Services as well, just like we have now to add to it. Or, some cities, and so that's how they get money back into the nonprofits through the Community Development Block Grant Program. Or the city runs their own housing department.
Mary,
We just have not got to that point yet to be able to do that.
Mary, the city that you had referenced earlier, do you mind telling us which city that is? The one that had the 7 or 8
Gilbert.
Gilbert?
But it's easy to look at cities across the country,
Absolutely.
and every city has its unique list of priorities. And, and as far as CDGB funding, cities use that funding for, housing rehabilitation for the elderly, to replace, items in their home for safety, prevent fires, that type of thing. But the CDGB funding can be substantial and can be very, very beneficial for our community.
Absolutely. And I think knowing that, we'll be there in the next 3 to 5 years, really, I mean, I think that is a benefit to having that needs assessment done every, 5 years at most, so that we are aligning with what those needs are, because as we're going to get more funding, we're going to have those opportunities. I think we actually used to have a weatherization program that was based off of funding and everything as well, so that same kind of concept, so.
So, if I may ask a question, I'm all in favor of needs assessment and such, but having only been a short time on the commission, I am kind of seeing the same folks, right, the same nonprofits show up. So if we know what the needs are here, how does that encourage those types of nonprofits to even apply for our funding? I keep running into kind of a roadblock of, if we only have 4 or 5 nonprofits applying for this funding, why? And even if we know what the needs are, is there any guarantee, or what can we do as a commission to actually help them move forward? So we know that there's quarterly numbers, right, that the city clerk sees. And we know that those nonprofits are very good at keeping their books and all of that, and they're doing a fine job, right? Is this a root cause, perhaps, of why some of these smaller areas or these smaller nonprofits don't apply? Maybe they don't have, as much the ability to, have the larger accounting and so forth. So I think all of these ideas are fantastic, but if we have the funds and we have multi-year plans or whatever the case is, are we still going to accomplish what we want to?
Yeah.
So I can answer a couple of those.
Okay.
One, why we had the same nonprofits year after year. In a prior, let's see how I can say this, city clerk office personnel,
I'm following.
the same ones were always contacted. And there was a debatable issue whether some of the nonprofits helped the city residents, or were they helping people outside of the city, or people that really didn't, this is a good one, have an address, period.
So we had some problems
We
with
had
that.
some problems
We've
with that.
changed
and
that
then-
approach.
And we have changed that. Now, in the past, even Horizon, when they still had a grant person, or sort of a grant person running special programs, they applied. So we have had other organizations apply, but I think the same ones that apply year after year are the ones that are really doing the grassroots need as far as the feeding. And, I mean, I think that's paramount, that those organizations continue to be.
But then it kind of works in a counter, I don't know what the word is I want to say, but if we know that feeding the community is probably the primary thing that we need to do, then is it worth taking funding and doing needs assessments?
Well, and I really don't think we need to have another research project on what the city needs. I think it's pretty black and white what the city needs. It's a matter, I think, of some of the organizations not having a person type that can apply for it.
Okay.
Whether we have not like a job fair, but, you know, if the Health and Human Service Commission themselves puts out for an evening for if you're interested in, you know, to the local nonprofits and say, if you want to come and meet with us or sign up on this list, we can send. And then I hate to say it, but then it's you guys' hard job to who gets how much and
Well,
when.
To me, I mean, and I think we started our conversation, right, talking about the public forum or,
Yeah.
that to me is the value add, is inviting these smaller agencies that we don't hear a lot from that are doing their piece for our city.
But
Right.
I think the challenge from my experience and being in that world, when I was at least, is I know that I had clients that would come to my office and get food, go the same day or the next day, day after to the food bank and get food, and then also go to the Salvation Army and get food. And that's 3 agencies in the community, 3 of which, or 2 of which at the time, were getting funding from the city. So if we're duplicating those resources, I'm not going to discredit that they might need that, but if we're duplicating those efforts, that's money that we're losing out on in really addressing a root cause of the issue. And I think that that kind of goes back to Mary's point about where is this collaboration happening and what can we do to make sure that our local agencies also have a voice on the higher level, because if we need to bring in resources from the county, from either Pinal County or Maricopa County, the state, to help us address these challenges, then that's what we have to do. We cannot expect the lines at every social service agency just get bigger and bigger and bigger and say, well, the need is there, we need it, and then come back and say, well, that's the community need. We know we have people who are food insecure. That's not going anywhere. But we can't use that as a, well, people are food insecure and that's a need, so we have to fund it. There might be a bigger need. We might have a larger issue that we need job training to help people get into that. We might have an issue. Transportation has come up how many times over the last several years, that if transportation in getting to the jobs in Mesa or Tempe or Phoenix are the root cause of why that person is going to the food bank or the Salvation Army or another agency because they can't get a higher paying job, let's address transportation. Let's use Health and Human Services funding to address transportation, whatever that might be. That's going to hopefully get that person out of the line at the food bank, out of the line at Salvation Army, get them into a better position, and move on to helping somebody else. That helps everybody at all the agencies, that helps the taxpayers with the money that we're responsible for, and it helps the family and the household at the end of the day who needs the service. I mean, we know mental health is a crisis as well. Are we going to continue to say, well, mental health is a crisis, and what are we going to do? We need to bring in another agency, or are we going to work to actually help the person that needs the help, and what that looks like?
I think that no matter who you help, I think the majority of the citizens don't necessarily double dip or triple dip food. And if they do, are they helping someone else that can't make it there, or are they holding that? I wouldn't hold that against anybody, because you're always going to have your 1 or 2 people or 10 people that take advantage of any situation.
Agreed.
So I can understand I think with the limited money that we do have, I think you guys have all been extremely responsible in delving it out. And I don't want your job. I don't know. I mean, I wish we had more money, but that's also not the job of the city to be a funder. There's many other sources. So I don't feel like we haven't met the need of those that have applied. And when other organizations have applied, as long as they're helping people that live in our city in some way, whether it's mental health, whether it's food, whether it's getting them to the doctor and getting them signed up on Access. I think you guys have done a really good job on it. We can always change things, but at this point, I don't know what we would do different.
But I don't think, first of all, I don't think having more money solves the problem. We can't just continue to
Absolutely
throw
not.
money at any problem, and I don't want that to ever be a topic of conversation anywhere. But I think if our agencies across the board, however many we fund, are helping the same 5,000 people year over year over year, and Jeff mentioned an agency earlier that's gotten funding since 2011, if they're helping the same 1,000 people year over year over year, what have they done? Quite frankly, what have they done? And that need is just going to continue to perpetuate, and at some point, the agency and therefore the people are reliant off the government and not being self-sufficient. It is not our job to make sure that, as a government, it's not our job to make sure that the same 5 people, the same 10 people, the same 1,000 people are getting that same service year over year over year. We have to make sure that we are addressing the root cause of the issue, getting them a hand up so that they're able to better their lives and we can move on to the next problem. Otherwise, let's throw the whole $40 million at people and just solve their problems year over year, because that's what we're going to continue to do. And that need is going to continue to grow.
But who are we to decide who reaps the benefits from these programs? I mean, I know you use it just as an example, but like transportation. There's not enough money in the budget to hold up transportation. You would completely deplete all of your funding to try to get transportation off the ground, and then every year you would be in the hole.
Absolutely.
So if that would be ridiculous to pull funding away from something else to try to tackle something like transportation when there's just not enough money to do it, no matter how you want to look at it. But I know that was just an example. You're not
Right.
saying that to go and do it. But whether they're helping the same 5,000 or 7,000 people year after year, why does that matter? I mean, is there
Because what
is there a
5,000
pecking order of which ones deserve it more than others? If the ones that are getting help right now, are you suggesting that those are the people that are just becoming dependent and we should actually give them a trade, give them some training, give them a means to be able to satisfy themselves, and then go after other organizations?
Absolutely. It's not our job to, if we were funding you year over year over year over year, and you're going to become reliant on us at this point. You know you're going to get the same, you know that 52 weeks a year you're going to get the same amount of food or funding or whatever to sustain whatever it is that you're doing. Are you really going to go out and try to better yourself and better your life? No, you're not. You're
What are
going
we
to
gonna
become
do
dependent
60
on the
months from
government.
now?
I'm sorry?
What are we gonna do 60 months from now? Oh, those people now who've been on the system for 5 years, are we gonna change it all over again?
But the goal, therefore, should be to work with our agencies, work with the community, work with other people across the state in terms of agencies and opportunities to help people get to a better point in life.
Is there something you specifically have in mind that you would like to see the funding go to?
No, I'm not saying that funding needs to go to one particular area. I'm just saying that we need to overall do a better job about systematically addressing the root cause of the issue. Again, food insecurity. If food insecurity is the issue, why is that the issue? Is it due to...
We're not entirely sure that is the issue, though, are we?
But again, another reason for a community needs assessment. We don't know what the issue in the community necessarily is, but as it's been pointed out, we know people are showing up at the food bank. We know they're showing up at the Salvation Army, so clearly there's a need. Well, yeah, there's a need.
And they've been satisfied.
And they've been satisfied. But is that the greatest need in the community? We know people are showing up at Horizon. We know they're showing up at Axiom and the other mental health providers. Is that the greatest need in the community? Are we missing the boat there? As far as I'm aware, we're not funding any mental health agencies that I know of right now.
Well, we're not out to save the world. We're just to help the people.
Agreed.
They haven't applied. though,
Exactly, that goes back to my point.
Agreed.
They haven't applied.
But have they not applied because they know that
So should they
4
be
agencies
solicited?
in the
Are you saying
community?
we should solicit these other organizations? Say, come on, come
We've
apply.
solicited them, and they have 2 years ago, we had 2 mental health agencies apply, and funding went to different places. But that's kind of what I would agree. I know for a fact that I've talked to agencies that won't apply because they know the same agencies get the funding, so they don't apply.
I think if they don't apply on that basis, that they don't have a real strong argument of what service they're providing. And I personally don't care if the same 5,000 people that need food show up at the food bank year after year, just as long as we have the food to give to them, as well as the food bank isn't surviving on our donation. They get donations, and that's part of the application. Who else have you applied to? We're not, there's people out there, and you being in the nonprofit world should know this too, that I don't care what you do for them, they don't have the ability to go work. They don't have the ability, and they have to rely on places like Genesis and the food bank year after year, and that's not going to go away.
I agree.
So why would you say, well, they apply every year, so let's give it to somebody else?
So what about the people who don't have to rely on the government? Absolutely, there are people who are going to have to rely on services. That's a no-brainer. That's an absolute given. But what are we doing about the people who don't have to rely on the services? So the need's going to continue to grow. So let's say we've got 40,000 people in the city right now that are all of a sudden need to be at the food bank. We've got the funding. We're just going to dole that out and continue to support the same 40,000 people year over year over year.
That doesn't happen, though.
But that
I
need
mean,
is growing, though. That's the concern.
may
The
be
need is
but
growing.
So is homelessness growing.
Absolutely. So what are we doing to
And
address
so
homelessness?
If homelessness is growing, food bank is growing. And like I told the lady from MAG that came the one night and gave her presentation, was it MAG or CAG?
Meg.
MAG. Show me the money. The feds don't have any money or don't give out any money. The state doesn't give out any money. We as a small city definitely cannot provide money for homelessness. We can, however, help the organizations feed people. And I don't have a problem with how you've done it in the past. I don't have a problem with the application. I would love, but I don't also want to speak to the commission's time frame to have some community outreach, whether it's at, one-on-one, going to different nonprofits and saying what is your biggest need that you see? But I think the job that you guys are doing is great. I love the checks and balances. I hope that the city clerk can share with you the different reports, because that will only help you understand how it's going, and I'll shut up now.
Well, I would ask this question of council: are you open to changing ordinances based on feedback? Like if we get the feedback from let's call it the root cause, for example. You know, I've been out there doing what's called the PIT count, the point-in-time count of homelessness. I'm hearing things a lot of times like, I have to keep going, keep moving, because there's an ordinance that you can't stay overnight somewhere. There's nowhere safe to go.
Right.
So they're out in the desert, they're moving around, they're behind trash cans. Little things like that. Are you open to changing that ordinance to the city? Like, hey, you know, we've got feedback that there's nowhere safe to go overnight, and now we can create safe spaces and see if that's a start at addressing what Braden's talking about.
You mean the camping ordinance?
Exactly.
You know,
It's an idea. Nationwide, Walmart
And
will
I-
allow you to camp in a parking lot, but our
Yeah.
city ordinance won't. So,
well, the Walmart is private property.
Correct.
And if they say you can't camp there, you can't camp.
the sign says, according to our ordinance 15-315 or something.
On the sidewalk,
It
but
does
not
say
in
that.
their parking lot.
In the parking lot, yeah.
You know, and in the past, I've spoken to the chief of police about this, because the city owns different parcels throughout the city that could we establish a safe place
Right.
for people to camp? And he says, well, the problem is, when you open it up to the homeless, then you have the element of
NIMBY.
drugs and negative things happening there that you wouldn't want to, as a woman or somebody with children, be around, and then it has to be patrolled. You have to have a security of some kind there. And that's, once again, the funding issue. And where would we fund a security team to patrol it?
We continue to feed the same people every year.
Right now, we have a homeless camp that needs cleaned up. I don't like the fact that our employees, our park rangers, our volunteers clean up those camps, because it's a biohazard between needles and human waste. And if it's on the state land, I think the state should reimburse us, or the state should send a biohazardous team out there. So homelessness, we don't have a hotel like La Mesita to send people to. Unfortunately, we're a smaller town. You know, bigger towns have more services. Do we say, sorry, we don't have that, but here's where you might get a room?
But to challenge that, and again, that comes down to what are we doing to reach out to those larger agencies? There used to be a major problem with trying to get the very people you had talked about earlier, Gail, who we were trying to service as agencies who didn't have a driver's license or an address or even a social security card because they lost those, that how were we going to get them those documents? Luckily, we had an agency with the Genesis Project who stepped up and worked with the post office to establish a general delivery service.
Right.
That's been running and running great, which provided us an avenue there. We also then went to the Social Security office and said, look, this whole you forcing people to go to 7th Street in Washington who are homeless doesn't work. You need to provide your services out here. What did they do? They've started providing them at the local office. The DMV, who used to not provide services to people at our local DMV, has started providing those services through Project Connects and things along that line. So there are other avenues that I think that we all have to look into, rather than just saying, well, we're just going to continue to dole the funding and hope that things get better at some point in time. We've got to establish a plan of attack. And what are our goals over the next 5 years? Do we want to take, and again, I'm spitballing numbers here. If, let's say, homelessness is at 20% in the city, what are we doing to reduce it? If food insecurity is at 20% in the city, what are we doing to reduce it? If education and educating our kids, or reading by 3rd grade, is at a 60% level and we're trying to take it to an 80% level, which Pinal County is, what are we doing to address that challenge? And that requires a set of goals, working together as organizations, as a council, as a Health and Human Services Committee, as nonprofit organizations, and with partners and other funders to meet those goals and then move on beyond that. And that's what we don't have.
The whole camping thing, that's a whole other ballgame as far as I'm concerned. But if some of these nonprofit organizations that are well-run and logistically do not depend on government funding to supply the needs to their people, that tells me that they're run well enough to be able to apply to get their funding. A lot of things are saying, well, they might not have a department where they apply for these things, but you throw me an organization that is run well enough to be self-sustaining, that organization should be able to, although it'd be nice to have some funding from the city to help maybe special projects, but that organization should be able to figure out and to apply and to go and they don't need someone to help them along the way.
Yeah.
They've already figured it out. So if they're not doing it, then they're not doing it, and that's basically how I feel about it.
All right, I'm going to ask down here, any comments?
The only comments that I have, listening to everybody talk about this, is the same questions I've had. I mean, not questions, comment. We're a policy-making organization, if you want to call it that. I think we need to look at two things, hearing Gail and Braden talk. Do we need to place limitations on organizations of how often they can apply? Like, just as an example, you can only apply for 3 years and then you have to sit out for a year or two. I'm not saying that's something that's needed, just is that something we, as a policy-making board, need to look at? Do we need to look at anything of how many agencies like transportation, kids programs, food, mental health, do we need to limit it of how many people so that you don't have 10 agencies all applying in one area? Maybe you're only allowed to have 1 or 2 apply, or to select 1 or 2 out of any one category. So I think that's what we should be looking at is some of these policies, along with what Jeff said about our ordinances. You know, I think it's up to them to decide, because that's what we've entrusted them to do, is to how they want to run this. We make the policies, let them run it. You know, if they want to see each of those organizations in person quarterly, that's for them to make that policy decision there to tell them. We don't have to tell Boys and Girls Club or Horizon Health that they have to not only turn in a report, but they got to come before this board and this commission and give them a report. They can do that. They should be given that authority. So.
When I think in terms, oh, go ahead, sorry.
I was going to say, Kelly?
Well, I was just going to ask Braden, in terms of, you know, if we have approximately $80,000 that we give out into the community, you know, are we going to spend that money on a needs assessment? And so then our people don't get the money? You know what I mean? I guess that would be my concern. I have no idea what a needs assessment looks like or costs.
So my suggestion to that, so that it didn't come out of the city's general budget, and I mean, it certainly could, and that's a conversation that well, I guess you all can have after tomorrow, but is that for 1 year, yes, we would give the Health and Human Services Commission $20,000 or $30,000, whatever that number was decided for 1 year, so that as a collective body between the commission and the council and the agencies, we can all do a community needs assessment and really figure out what's going on, set priorities and goals for the next 5 years, and then go from there at that point. And in 5 years, you at that point really need to update your CNA, and that establishes the next 5 years of priorities and goals. Because right now we are just giving out money and we don't know what the root benefit is. We just don't. And I don't care what anybody says or what report you look at. We do not know the actual impact of our 80,000, 100,000, whatever it is, to the city and its residents.
Someone's eating tonight.
It's just a tangent. I think there are several issues you've touched upon. One is that Arizona State University has some projects, and they have students that go out and do these surveys.
Yes, they do.
Yeah, and it's not going to cost you a dime. Number two, I was sort of in this strange state where I had this revelation, sadly too late, with the group that I was dealing with as a physician, and that's that Pinell County over this last year has had free tuition to the community colleges to anyone that lived in Pinell County. How much was that taken advantage of? How much was made accessible to people? The issue of eating is really important. I contribute, this isn't self-laudatory, to St. Mary's Food Bank, and I have to assume St. Mary's Food Bank provides some sources. But I've always wondered whether or not there's a move to try, like when I was medical director at a New Leaf, and asked Mike Hughes, are we making land available to have a community garden so people can have some self-sustaining stuff? We're not going to graze cattle or raise pigs or anything, chickens. They might, I guess. They could have eggs. But the point is that would meet some of the issues that you're talking about sustainability.
Yeah.
But let me hit my specialty, psychiatry. There's some people that are remarkably ill, as well as people that are very physically ill, that as much as we might want them to be able to go out and be self-sustaining, they're just incapable of doing that.
Absolutely.
So I think that there is a sense of community responsibility for our fellow human beings that hopefully we take to heart. And that as we look at this, I've championed sort of a mechanism to look at, if you will, a satisfaction survey to see whether or not the individuals believe that the needs that they went to the agency for are being met.
Yep.
And then utilize that, not necessarily as a punitive measure, but to say, okay, now look at this as a continuous improvement format to see how you can better meet those needs.
Right.
But in addition, you know, there are various things that the Bill Gates Foundation have done. How much collaboration is done with those philanthropic organizations to meet certain things? You know, we have Elon Musk living in a boxable. Now, that's his deal because he's invested in that and he wants to make a big publicity stunt out of it. But nonetheless, those are really interesting. Arnold Schwarzenegger provided 2,500 tiny homes to LA City to deal with the homeless. We can as well look at whether or not we can get those kind of individuals or individuals locally that have those sorts of assets to be able to look at those ways of helping solve some of these other issues.
Okay. I am going to just kind of bring this up to a kind of conclusion in it. Our wonderful hour is now coming to an end. I think, you know, one of the things that we had mentioned, the aspect in it, and I have to, you know, agree that, yes, we can request that they, the not-for-profits that are being involved and also future, I'm going to say all nonprofits can come before the commission, and I encourage that to happen so that they can do their presentation and let you know what they're doing and how they're working with the community and the needs. I look at the actual needs in the study of doing some needs, maybe even go to the nonprofits and ask for them to do a survey of some of their clients and you know, what's going on and what their needs are. I don't know if that's something that we as a city would have to be responsible for in setting up. It's something that we can work with the nonprofits to see if we can, you know, come up with something like that. Because I do agree that if we're not meeting their needs in general, that's something that we need to look at. Vice versa, if we're meeting their needs and what they're needing, okay, well, that's what we need to do. Now, how can we move them on in this aspect as well? And again, outreach to the nonprofits, I'm going to have to look to, I'll say, city clerk and others to find out how we can actually contact all the nonprofits in the area and to have them, you know, actually possibly even schedule appointments for them to come before you and do their presentation. And if we need to look at our policies and make any changes in it, I would look for feedback from you all as to what some of the things that you all think we need as well, and what we can do for, as a council can do to help in this situation. Anything that I missed? Okay, well, I thank you for this joint meeting,
Thank all of you for coming.
and I'm going to call it adjourned.